Hi everyone, welcome back to my YouTube channel, KMW Runners Show. Today's video is about peptic ulcer, and peptic ulcer consists of esophagus ulcer, gastric ulcer or stomach ulcer. Then we have the duodenal ulcer or the small intestine ulcer. But these three type of ulcer, they have the same causes and then the same treatment. I know you at some point you would have been scared about contracting ulcer. For instance, when you are having a discussion with someone and then you get to know that okay, this person is having ulcer. Probably the person tells you that he's having ulcer, stomach pains, and all of it, and then you'll be wondering that what is the cause of this ulcer? Why are you having ulcer? You'll be having this kind of thought and then fear within yourself. Well, worry no more because I'm about to tell you the causes of this ulcer and then the treatment and tips to avoiding having ulcer. And then also, have you ever wondered why it is women or ladies that have this ulcer most, like peptic ulcer most? It's women. Don't also worry. Just stick with me on this video. Then I would tell you reasons, and then you'll be able to deduce the reason why it is women that have this ulcer most. What is a peptic ulcer? Or let me just say generally, what is a stomach ulcer? Let me just stick with stomach ulcer. So stomach ulcer is when there is a sore or there is a wound along the lining of the stomach walls. So when there is a wound and or there is a sore around the stomach wall, that's when we have a stomach ulcer, and then it is mainly caused by a bacteria called Helicobacter pylori, and also caused by by the effect of acid on the stomach walls. So those are the two major causes of this ulcer, stomach ulcer or peptic ulcer. So now that we know what ulcer is, what stomach ulcer is, and then the causes, if we are trying to deduce probably you might have this ulcer, then the symptoms of stomach ulcer the symptoms varies from having pains in the stomach, having sharp pains in the stomach, vomiting blood, having blood in your stool, or feeling dizzy, or feeling of being full while eating. You just eat a little, then you are feeling full, or when you're having heartburns or acid reflux and all of it. Those are the symptoms of stomach ulcer. But they are not enough evidence that you are having stomach ulcer. You also need to meet with your health provider or health practitioner about to actually diagnose if we have this ulcer truly. But let's go more in depth about how this stomach ulcer is really caused. So like I said earlier, the two causes of stomach ulcer are the first one is H. pylori, Helicobacter pylori, or acid, the effect of acid on the stomach walls. So how does this H. pylori actually causes stomach ulcer? The H. pylori can get into the stomach through food, through water, or close contact with someone that has ulcer before. So that is that's one of the ways this H. pylori can get into the stomach. And then generally it's not everyone that has this H. pylori in their stomach that has stomach ulcer. But what the H. pylori does is it inflames the stomach walls, and it can only get to inflame the stomach walls when the stomach walls when the mucosa protecting the stomach walls are already reduced. So that is when this H. pylori gets to to infect the stomach walls. And also acid also causes the stomach wall. And then there are several ways by which this acid can actually use in getting into the stomach. And then for example, the excessive use of non-steroidal inflammatory drugs. Yeah, so one of it, these drugs actually also causes the it causes the protection, the cytoprotection of the stomach walls to be reduced. Yeah, because all these drugs like ibuprofen, aspirin, diclofenac, or naproxen, they help in reducing pain, like menstrual pains in women, menstrual pains in women, or pains from injuries, or shears of the probably like when you sprain your muscle or anything. So these non-steroidal anti-inflammatory drugs, they help reduce pain. And the pathway for their function is just by inhibiting this kind of enzyme called cytooxygenase. And then we have two types of this cytooxygenase. We have one that is naturally found in the epithelial of the stomach, which is COX1, and then we have the ones that are induced by injury or by inflammation, and those are the COX2 that are found in the normal or injury sites. So, but when you are using this what's it called? When you are using non-steroidal anti-inflammatory drugs, they inhibit the production of this COX1 and COX2. They inhibit the production of both, and then it is this COX1 and COX2 that helps it reacts with what's it called, arachidonic acid to form prostanoid derivative or prostaglandins. And then the prostaglandins are naturally protective in the stomach linings. They actually protect the stomach walls, and then but at the site of injury also, they also protect the they also protect or help in healing process of injuries. But when they are produced in much quantity, where that's the prostaglandin, when they are produced in much quantity, they cause pain. So and it's COX2 that forms this prostaglandin. So the work of this non-steroidal anti-inflammatory drug is to inhibit this COX2. So but when this COX2 is now being used frequently, they just inhibit any form of COX they found in the body, and so it affects the stomach walls. It affects the mucus in the stomach wall to be reduced, and the cytoprotection by the COX will also be reduced, and then in turns it could now cause the infection of H. pylori, or the action of acid on the stomach walls. And then again we have a condition known as Zulinga. Zulinga is just like a condition that causes the excessive production of gastric acid. Yeah, so when this gastric acid are being produced in excess, they in turn affect the stomach walls. They affect it and makes the stomach wall sore or injured, and then in turn you'll be having stomach ulcer. So that's that's one of the effects of this non-steroidal anti-inflammatory drugs causing stomach ulcer. Also, we have another thing that can cause stomach ulcer, which is the use of tobacco or smoking. The use of tobacco or smoking actually also causes this stomach ulcer, because smoking inhibits the mucosal blood flows. They inhibit production of bicarbonate by the pancreas, and this bicarbonate serves as a buffer, or they neutralize the acid being produced naturally in the body, in the digestive system or in the stomach. So when you smoke a lot, this bicarbonate the production will be reduced. So the bottom line is that reduce smoking, if you know you are scared of having stomach ulcer. And also the use of alcohol, excessive use of alcohol also causes stomach ulcer. Yeah, so when you take alcohol a lot, it activates the production of this stomach acid also, and then it makes the mucosa, the production of mucosa reduced in the stomach lining, and then in turns causes stomach ulcer. So, but the major causes of this stomach ulcer is non-steroidal anti-inflammatory drugs. And then you would see that it is ladies that actually do take these drugs a lot because of their stomach cramps or their body pain or this thing. And again, there are some myths about stomach ulcer. For instance, stress. Some people know that some people say that stress could be the cause of stomach ulcer. Though stress is not the direct cause of stomach ulcer, but when people are stressed, they tend to use these non-steroidal drugs to ease their stress. And then you see that I've done a previous video about easing stress, so you can as well just go for natural remedies for easing stress, like exercise or making your home comfortable and the like. You can go back to my previous video if you've not seen the tips for easing stress. So people tend to use these non-steroidal drugs to ease their stress, and that is why in turn it causes stomach ulcer. So yes, so that is why it causes stomach ulcer. So having know the causes and then the intrinsic of this stomach ulcer, the treatment is very simple. When you feel like you're having any of these symptoms, like stomach pains, or you are having stool in your blood, in your feces or your urine, or you are vomiting blood, or you have chest pain, acid flux and the likes, though there are not enough evidence for you to say you are having stomach ulcer, you still need to meet your health practitioner, then so that you can be diagnosed of this stomach ulcer. There is endoscopy that they are going to do to check if there's an ulcer in your stomach or in your small intestine. So when they found out that you're having stomach ulcer, there are several treatments for it. The first type of treatment is giving you antibacterial, antibiotics that is going to kill this H. pylori. And then you need to adhere to the treatment plan. They might give you two type of antibacterials to kill any type of resistant and H. pylori. So you need to use it appropriately, and then they might give you acid inhibitors, like that would inhibit the production of acid in your stomach, like proton pump inhibitors or histamine receptor inhibitors. So those PPIs will help to reduce the way your stomach produces acid, and in turn reduces your ulcer symptoms, and then you can be fine. So those are the treatments for this ulcer. And also there are some foods that you would eat that can prompt your ulcer, that will make it aggravated. So foods for you to avoid, avoiding spicy food, or avoid eating late, or fasting. Avoid fasting, avoid citrus fruits like oranges, avoid pineapples, avoid alcohol, avoid smoking also. So those are the things for you to avoid. And then foods that can help also to promote or to help cure your ulcer are foods like raspberry, broccoli, cauliflower, several foods that you can actually food that you can take that will help to serve as buffer for the acids that are being naturally produced in your stomach. So in turn, you won't be having the normal acid or acid generally in your stomach affecting your stomach walls. So that is that about stomach ulcer. Very short, very brief, and then prevention is better than cure. So just take note of these things I mentioned, and then work with them appropriately, so you won't have ulcer or have any cause to be scared about having stomach ulcer. Yeah, so if you if you gain value from today's video, don't forget to subscribe to my YouTube channel, to be like a motivation for me to actually put more videos on out for general body wellness and then lifestyle. So thank you for watching today's video. I remain your favorite YouTuber. Yeah, bye.